name's Anna. I'm going to be your student nurse today. And today we're just going to go over some of your health history and just get a general idea of your past health and everything like that. So first, can you tell me your name and date of birth, please?
Aiden Anderson, October 19th, 2002.
Okay. And before we begin, I'm just going to let you know, if you're uncomfortable with any questions I asked today, you're more than welcome to say that you prefer not to answer. Okay. So first, can you tell me how you feel about your overall health?
Good.
Good. Do you have any concerns or questions?
Nope.
Okay. So first, we're going to look at your past health. And do you recall if you've ever had like measles, mumps, chicken pox,
Chicken pox.
strep throat?
Strep throat.
You've had both.
Mm-hmm.
Do you remember how old you were, or how bad were the symptoms, that kind of thing?
Around 10 years old. And say average symptoms and strep throat common.
Common?
Mm-hmm.
Did you have it more than once or just one time?
A few times.
Okay. Did you ever have scarlet fever or any other
No.
severe fevers? Okay. Now, do you remember if you've ever been in any auto or car accidents or fractures, that kind of
No.
thing? Have you ever had any head injuries, loss of consciousness,
No.
any burns?
No.
Okay. And have you ever had any broken bones?
No.
Okay. Have you ever had asthma, diabetes, hypertension?
No.
Okay. Have you ever had depression symptoms or anything like that?
Yes.
Can you describe how that is for you? Do you have them frequently, or is it ongoing?
Throughout childhood.
Okay, throughout your childhood. Do you have any history of heart disease or sickle cell anemia?
No.
Any histories of cancers for yourself?
No.
Any histories of seizure disorders?
No.
Okay. Can you recall any hospitalizations and what were the cause of those?
No.
Okay. Do you remember any surgeries that you may have had when they were?
Dental surgeries when I was a small child.
Okay. Do you remember what was performed in those dental surgeries?
Pulling of baby teeth and crowns.
Crowns? Okay. Do you remember how long the recovery was?
A few days.
Okay. Do you remember the surgeon's name by chance?
Absolutely not.
Okay. Now, do you know, like, your vaccination history? When was the last time you got your influenza shot?
Prefer not to answer.
Okay. That's fine. Do you know when your last physical was or dental exam?
Prefer not to answer.
Okay. Any blood work in the past few years?
No.
Or before? Do you have any allergies to medication?
Yeah. Erythromycin.
Erythromycin? Okay. Any food allergies?
No.
Do you have any allergies to like certain fabrics or pollen, that kind of thing?
Not severely.
Okay. What reactions do you have if they're not severe?
Sometimes stuffy nose and
Okay.
and spring.
With pollen?
Pretty much just spring. Yeah.
Okay. Do you have any side effects with some medications that aren't supposed to happen that you know of?
No.
Okay. What kind of medications are you taking currently? Any over-the-counter medications like Advil or Tylenol, that kind of thing?
No.
Okay. Any herbal medications?
Nope.
Okay. How often do you exercise?
Probably at least twice a week.
Okay. And do you do cardio, or is it mainly weights? What kind of exercise?
Cardio.
Cardio? Okay. How long do you usually do that for? in an average period?
A couple hours.
Okay. And do you have any spiritual practices or any cultural things I should know about that might impact your care?
No.
Okay. Are there any foods that you avoid eating?
Meat.
Meat? Does that include fish?
No.
Okay. Do you have any recent weight loss or gains?
No.
Okay. Do you experience any fatigue or fevers, chills, sweats
No.
abnormally? Okay. Do you have any history of skin disease such as like eczema or hives?
No.
Any changes in your pigment or like the color of your skin?
Nope.
Okay. Any changes in any moles that you may have?
No.
Okay. Do you notice any excessive dryness or moisture in your skin?
No.
Any abnormal bruising?
No.
Okay. Any rashes?
No.
Okay. Have you experienced any recent loss in hair or any texture changes in your hair?
No.
Okay. Any changes to your nails, such as like their shape or if they're more brittle than usual or color changes?
No.
Okay. Have you had a large amount of sun exposure recently?
No.
Okay. How often do you use sunscreen when you are exposed to the sun?
Quite frequently.
Okay. Do you use it on a daily basis or just?
No.
Okay. When do you just use it when you know you're in direct sun?
Yes.
So more summertime, not winter.
Mm-hmm.
Okay. Do you have any unusual or frequent severe headaches?
No.
Any head injuries recently?
No.
Dizziness or vertigo?
No.
Okay. Have you had any difficult with vision or eye infections in the past?
No.
Okay. Any earaches, infections, or hearing loss?
No.
Okay. Do you have any discharge or unusual characteristics from your nose or like the sinus drainage?
No.
Okay. Do you have unusually frequent or severe colds?
No.
Do you have any sinus pain in the past?
No.
Okay. Any nosebleeds?
Very sparsely.
How many have you had, would you say, that you can recall?
5.
5? Okay. Are they? Do you usually have to go to the hospital to
No.
get them to stop, or they
No.
stop on their own?
Nope. So.
Okay. Any changes in your sense of smell?
Nope.
Okay. Do you have any mouth pain, frequent sore throats, bleeding gums, toothaches?
No.
Okay. Do you have any cuts on your mouth or tongue that won't heal or
Nope.
anything? Okay. Do you have any hoarseness you find in your throat?
No.
Any altered taste
No.
of foods? Okay. Do you have any abnormal, like, discharge from your chest, from your nipples?
No.
Okay. Any abnormal lumps that you find in your chest area?
No.
Okay. Do you have any lung disease like asthma, bronchitis, pneumonia,
No.
tuberculosis?
No.
Any abnormal chest pain with breathing?
Nope.
Okay. Do you notice wheezy or noisy breathing at any time? Okay. Do you experience any shortness of breath?
Nope.
Do you often have like phlegm that you cough up, and if you do, what color does it typically present itself as?
Sometimes and mainly clear.
Okay. Okay, and then do you have a lot of pollution exposure, would you say?
No.
Okay. Do you have any chest pain or pressure experience, tightness,
No.
sensations, any palpitations?
No.
Okay. Do you have a heart murmur or anemia that you know about?
No.
Do you have any blood clot or bleeding disorders?
No.
Okay. How often do you use the bathroom to move your bowels?
Twice a day.
Okay. Do you have any changes in your bowel habits on a day-to-day basis?
Not really.
Okay. Any diarrhea or constipation you've been experiencing?
No.
Okay. How would you describe your urine and how often do you have to relieve yourself?
Usually clear
Okay.
and 4 times a day.
Okay. Do you have any burning or pain or any history of urinary tract infections?
No.
Okay. Do you have any history of kidney disease?
No.
Any pain in your pubic area or abdominal?
Nope.
Okay. Do you have any issues with hernias?
Nope.
And do you perform regular testicular exams?
Mm-hmm.
You do? Okay. Do you have any pain, stiffness, swelling, any limitation in any muscle areas, like your arms, legs? Okay. No cramps, weakness?
Nope.
Okay. You don't have any issues with your coordination on a day-to-day basis?
No.
Okay, good. Have you ever had any issues with fainting or blackouts? Any coordination issues or nervousness, mood changes? Any hallucinations?
No.
Do you ever experience excessive bruising or bleeding disorders?
No.
Okay. Do you have diabetes?
No.
Okay. Any history of thyroid disease or intolerance to heat and cold?
No.
Okay. So how would you say your sleep is overall? Do you get regular? How often do you go to sleep, naps, anything?
Regular amount of sleep.
How many hours would you say you sleep a night?
7 to 8.
Okay. Do you use any sleep aids like sleeping
Nope.
medications? Okay. Describe what you eat in a typical day for me, please.
3 meals a day
Okay.
to 2 meals a day,
Okay.
consisting of protein, a vegetable, and carbs.
Okay.
Lots of water.
Lots of water. Good. Do you have I think I might have asked you this before, but no history of food allergies?
No.
Do you have any practices besides non-meat eating in your daily?
No.
Okay. Do you feel you have a good support system around you with family, friends?
Yes.
Okay, good. Do you feel safe in your relationship right now?
Mm-hmm.
Good. How do you feel you handle stress? Do you handle it okay? And how do you handle it when you are in a stressful situation?
Yes. And adequately.
Okay. And then, do you use any tobacco, alcohol, any other
No.
drugs? Over the counter or
No.
otherwise? Okay. And that is it for today. Thank you very much for your time. Boop-a-doop-a-doop.